What's going on, moms and dads? My name is Dr. John Caruso. I am a neurologically focused pediatric prenatal family wellness chiropractor in Katy, Texas. And we're going to talk about one of the most common things that I see in my practice with infants and young children. And that's what's called torticollis. So, torticollis can be a stressful and troubling diagnosis for our parents. And honestly, sometimes it seems like a never ending battle to work to get things not only back on track structurally, but also from a neurodevelopmental standpoint within our kiddos. And so, as a pediatric chiropractor, I specialize in the care of these common infant challenges like latch and feeding and reflux and constipation and torticollis and plagiocephaly or that flathead syndrome. And the one thing that I can also share with you is that when we're talking about torticollis and plagiocephaly for that matter, so many of these cases are absolutely missed and dismissed by your average pediatrician. And so in this video, we're going to go over the four main things that you need to know about torticollis and plagiocephaly, including how to find out if your child has these challenges and what you can do to help. So share this with any other moms or any other parents that you know need to hear this to be able to help their kids. And so, with the significant and rapid rise and increase in birth intervention and birth trauma, we see more and more cases of things like torticollis and plagiocephaly every single year. And so unfortunately for most parents, traditional medicine has not necessarily updated their understanding of what's causing it and also how to best take care of it for some time, which then leaves most families with only traditional treatment options like physical therapy that doesn't actually get to the root cause of the problem. And like many of these cases with torticollis, what it really impacts is their overall quality of life in several different ways. A lot of them will struggle to hit their milestones. They'll feel stiff and rigid and tensioned and arching and absolutely uncomfortable and then locked up the majority of their times. And honestly, what we see then later is as these kids continue to grow, that locked up tension within the body, within the nervous system, within their muscles also contributes to things not draining and plumbing properly, causing tons of congestion and drainage and stuckedness and ear infections. And this honestly just leaves moms desperate to find help for their baby because they're not getting what they need from PT, OT, and it's just simply not doing the trick. And so a lot of these moms, while researching, will stumble upon pediatric chiropractic as a option for kids struggling with torticollis and plagiocephaly. And what's cool is that there does seem to be a shift happening within this amazing generation of parents who are seeking out pediatric chiropractic more often and earlier than ever before for their kids. And so these parents and families are seeing absolutely incredible results with gentle and effective and long-lasting approaches to their child's torticollis. And so when we're talking about torticollis, like how does it happen? And then what is like the root cause of torticollis? So torticollis is a diagnosed medical condition that's typically considered congenital if it's caused by things like abnormal positioning of the baby in the uterus whenever they're still in the womb. And this typically happens with things such as like a breech position, transverse position, OP, or like sunny side up, or even things like lowered amniotic fluid within the womb space. But the most common form of torticollis is called acquired. And the most common cause of this acquired torticollis is from birth trauma. So the amount of physical strain and tension and pulling that's then placed on a baby's head and neck during birth interventions, such as forceps, vacuums, and cesareans, many times I should say, leaves significant amount of stress and tension, both physically and neurologically, which in our office is what's referred to as a subluxation, that then contributes to the torticollis. So when we're talking about stress stuck on our nervous system or subluxation, we're really looking at three main components. So there's the misalignment or the abnormal positioning of the bones within our spine, primarily within the neck, the upper neck primarily, especially when we're dealing with birth trauma. But the second is that there's fixation and reduced range of motion in the bones in the spine or the regions of that area where there is subluxation or stress stuck onto the neurological system. And then the third component is that neurological interference and imbalance that's caused simply by reduced amounts of what's called proprioception and increased amounts of what's called nociception. So like good information feeding up into the brain versus like stressful, sometimes chemically toxic stimulus feeding up into the brain. And so simply put, the more severe and the apparent that the torticollis and its related misalignments and fixations are, the more severe the stress stuck onto the nervous system or the patterns of subluxation likely are for that child. And so why are mild to even moderate cases of torticollis completely missed by typical pediatricians? And the first thing that we'd really encourage parents to do if they're concerned that their child may have torticollis is not necessarily just relying on their pediatrician or medical doctor's exams and findings. Of course, pediatricians are trained to perform physical exams in a way as to spot neuromuscular challenges like torticollis. Still, they don't have nearly the experience or detailed training in those systems of the body as a pediatric chiropractor or even a physical therapist would. And so if the pediatrician does not spot torticollis for a child, they will most likely make a referral to a physical therapist or a PT who then will show the parents a few positioning and stretching exercises that they can do at home to then help to alleviate the torticollis. However, at least within my clinical practice, most parents report to us that those stretches and the exercises are extremely painful for the child, and a lot of times they'll aggravate the torticollis or the stressful condition because of the sustained fight or flight, stuck on stress tension that's within the body that's called dysautonomia, or the imbalance within the autonomic nervous system. And so traditional treatment options such as physical therapy and helmets don't always get to the absolute root cause and the neurological component. That's why troubles can stay even though PT has since graduated them. And so this is exactly why parents routinely report that when they put pediatric chiropractic as the foundation or first choice for their child's torticollis, it then makes all the physical therapy stretches and all the positioning exercises so much easier and absolutely more effective. And as a pediatric chiropractor and a PX doc, I love nothing more than working in conjunction with any child's therapy team, whether it's speech, PT, OT, or even ABA for that matter, to be able to achieve maximum results for your child. And so the pediatric chiropractic approach to caring for torticollis is so often the one that parents feel makes the most sense. And it can be summarized in 3 simple steps. We have to first find and locate the exact location and the severity of the stress stuck onto the nervous system, or subluxation. Then we have to be able to make safe and gentle, what's referred to as neurotonal adjustments, to be able to relieve the tension and then remove those patterns of stuck stress or stress stuck on the nervous system that we call subluxation within the office. And then we have to encourage parents to watch closely for the reoccurrence of torticollis around growth spurts, and teething, or colds, illnesses, or other stressful events that the child may experience. I've seen this a handful of times in practice over the years where a baby had real bad torticollis or plagiocephaly, and we continue to see them in our office as a wellness patient for several years, and then big viruses or big bacterial sickness, immune challenges, or big demand and transitions like school and daycare and things like that will pop up. And honestly, what's interesting is you'll see when their body gets back into this fight or flight, stuck on stress state, that torticollis, the unevening of the shoulders, that head tilt, the uneven shoulder blades will actually pop back up. It's really interesting to see the reoccurrence of some of that because our body goes back within this stressful pattern, and then that's what it reverts to. And so what's really cool is that, well, I think it's cool, most parents think it's cool, is that pediatric chiropractors look deeper than any other practitioner in the pediatric space, specifically because we use what's called insight scanning technology to really find and locate those exact points of stress and dysfunction within the neuromuscular system. So this is beyond palpation, this is beyond visual observation, this is assessing the neurological component that's then altering the muscle component. And so one of the real keys to caring for torticollis is not just using positioning and range of motion testing as the only clinical criteria for resolving torticollis. And so as pediatric chiropractors, we routinely examine and evaluate kids ages 5 and up who had torticollis as an infant, did the traditional medical and therapy treatment only and still have retained torticollis all those years later. That's easily found on our insight scanning technology. For most kids, when we start doing the insight scanning technology, it's depending on the age, typically it's 1, sometimes 3 different pieces of testing. The first is really to measure the neurological tension, primarily irritation and inflammation to the nervous system, by using the neurothermal scan, which is basically just looking at pockets of inflammation and irritation all the way up the nervous system, which gives us the location and the depth of how this is impacting not only the muscle system, but the neurological system as well. The second, typically on ages 3 and up, most of the time 5 and up, we'll use what's called a surface EMG, which is basically just going to measure the energy within the musculature of the body. So it's looking at overall neurological tone and coordination within our motor system. And the most beneficial and the most impactful test that I can use on any patient within my office is what's called heart rate variability, which is going to just measure the balance within the parasympathetic and sympathetic to really dive deep and address that root cause of dysautonomia and stress stuck onto the nervous system. And so those 3 big pieces of technology allow us to really assess this neurological component that gets missed from every other provider and every other therapist that's working with these cases of torticollis and plagiocephaly and really any of the other conditions for that matter. And so in many cases, parents can really start to see results and see their child experience relief a lot of times in a couple of visits. And overall, it generally takes a couple of weeks and in some cases a few months to get the full resolution of torticollis. But before we get started, we're going to sit down and we're going to talk specifically about what all is going on within your child, going through the case history. What was birth like? What was pregnancy like? What was preconception looked like? How did those things contribute to what we call the perfect storm of stress and sickness and challenges within our kiddos? And then we sit down at what's called a report of findings visit. And then we show you and discuss the exact personalized plan of action for your kiddo in terms of how long and how often and what all of that entails. Because when it comes to torticollis or plagiocephaly or any of these big conditions and struggles that our kids have, there is no cookie cutter approach where every child gets the same stretches and positioning exercises. The examination that we use and the scanning process in office is crucial to making sure that we find the exact root cause of your child's challenges and then make the right adjustments through a care plan to get things taken care of. The majority of these torticollis cases really resolve, like I said, in a couple of weeks. And what moms typically see with a lot of these kids is bigger changes in mobility, the overall tension, happier, easygoing, easier to fall asleep, easier to poop. Immune system stuff kicks on a little bit faster, so they're not as sick as long. And it's one of the cool things that we get to watch as these kids grow and progress. And so if your mom or your dad gut, for that matter, is telling you that there is more going on than what your pediatrician or your physical therapist can fully explain and address, then neurologically focused pediatric chiropractic care is the absolute perfect fit for you and your family. Simply because we specialize in diving deeper and doing a more thorough assessment than anyone else out there, making sure that we actually get to the true root cause of torticollis. So what I'd love for you to do is give us a comment, shoot us a DM, reach out, because we are always happy to help. Share this with any of your friends, your families, your Facebook groups, and if you really want to dive deep onto torticollis, plagiocephaly, or reflux and constipation, or any of the other cool things that we have on our website, check out our article or our blog post, because we go in so much more detail there. I can't wait to hear from you all. Have a great day.